She said she was floating near the ceiling, looking down at her own body on the operating table. Her heart had been stopped. Her brain, by every measurement doctors had, should not have been capable of forming a single conscious thought. And yet she said she saw a surgical instrument that looked like an electric toothbrush. She said she heard a voice say the arteries were too small. Another voice answered, "Try the other side." She was under general anesthesia. Her eyes were taped shut. Her ears were plugged and covered. By the time this moment happened, Pam Reynolds should not have been able to see, hear, or remember anything at all. So how did she describe her own surgery? To understand that, we have to go back 2 years, to the headaches that started it all. Pam Reynolds was 35 years old when her life changed. She was a singer and songwriter, a mother, and someone living what appeared to be an ordinary, active life. Then came the headaches. They were severe enough to demand answers. Medical scans revealed a giant aneurysm deep inside her skull, located near the brainstem. It was in an area so difficult to reach that conventional surgery left little room for error. The problem was not simply removing the aneurysm. The problem was reaching it without causing catastrophic bleeding, stroke, or irreversible injury. Her doctors recommended a rare procedure known as hypothermic circulatory arrest. The procedure was extreme by design. Pam's body would be cooled far below normal temperature. Her heart would be stopped. Her circulation would be halted. And for a limited period, blood would not flow through her brain while surgeons worked to repair the aneurysm. The goal was to create a narrow surgical window, a moment in which the aneurysm could be treated with less danger of rupture. It was not a routine operation. It was chosen because the alternative could be fatal. Imagine being told that the people trying to save your life would need to stop your heart. Imagine entering that operating room knowing you might not wake up. This is the surgery that put her in the room we opened on. Pam's operation was led by Dr. Robert Spetzler, a prominent neurosurgeon associated with the Barrow Neurological Institute in Phoenix. The surgical plan was precise. Pam would first receive anesthesia. Her body temperature would then be lowered dramatically to roughly 15 degrees Celsius, far beneath normal body temperature. Her heart would be stopped. Her circulation would be temporarily stopped, and her body would be monitored with extraordinary care from beginning to end. To monitor auditory brainstem responses, clicks were delivered through small earphones placed inside Pam's ears. Her ears were packed and covered. Her eyes were taped shut. Medical staff watched the data coming from the equipment around her. Pam was surrounded by trained clinicians, advanced technology, and a procedure designed around precision and control. But according to Pam, something happened before the operation reached its most extreme phase. This is the moment we opened with. Here is the rest of it. Pam later said that during the surgery, she became aware of a sound, not the distant, distorted world of anesthesia, not a dream, a sound she compared to an electric dental drill. She later described feeling as if something inside her shifted. And then, she said, she was no longer experiencing the operation from the table. She was above it. From that vantage point, Pam said she saw a surgical instrument that reminded her of a toothbrush with a curved handle. She recalled seeing instruments arranged in a case. She also said she heard members of the surgical team speak. One detail stayed with her. Pam later reported hearing someone say that the arteries were too small. Another voice, she said, responded that the other side should be tried. To Pam, these were not vague impressions. They were specific observations, details she believed she could not have known. Her account became especially striking because her eyes were closed, her ears were covered, and she was under anesthesia. But this is where the story demands care. Pam's reported operating room observations are generally associated with the operation as a whole, not necessarily with the later phase when her circulation was completely stopped. That distinction would become central to the debate. What Pam described could have been experienced while surgery was underway, but before blood flow was halted. It may have occurred during the transition into the most critical phase, or it may have been formed as she emerged from it. No one can place a subjective experience on a clock with complete certainty, but Pam's story would soon move beyond the operating room into something even harder to explain. Eventually, the surgical team began the most perilous phase of the operation. Pam's body was cooled to a profoundly low temperature. Her heart was stopped. Her circulation was stopped. For a period commonly described in accounts of the case as roughly 45 minutes, surgeons repaired the aneurysm while circulation was deliberately halted. In retellings of this story, people often say that Pam had no brain activity. The reality is more precise and more complicated. The procedure involved extensive monitoring and a deliberate reduction or cessation of circulation. Different measurements capture different aspects of brain and body function. Reports about exactly what those measurements showed, when they showed it, and what they imply about awareness have been debated by doctors, researchers, and NDE investigators for years. What is undisputed is this: Pam Reynolds underwent an exceptionally invasive and dangerous procedure designed to temporarily stop circulation, and she survived it. Pam later said that after her awareness of the operating room, the experience changed. The sterile brightness of surgery disappeared. She described moving through darkness toward a light. Then she said she entered a place filled with warmth, clarity, and love. Pam said she encountered relatives who had died before her. She described recognizing people from her life, family members who appeared healthy, whole, and joyful. In her account, there was no terror. There was comfort. There was a sense of being understood completely, a feeling that she had come home. She also described a boundary, a point beyond which she believed she could not continue if she wanted to return to life. Pam said she did not want to go back. Why would she? The place she described was peaceful. The pain of the body was gone. The fear that had followed her into surgery had disappeared. But according to Pam's account, she was told, or somehow understood, that she needed to return. There were people she loved, a life unfinished, a body waiting. Some people interpret stories like Pam's as encounters with another reality. Others see them as the brain responding to extreme physical stress, anesthesia, fragmented sensory input, and altered states of awareness. Pam believed that what she encountered was real, and she said she returned from it changed. Pam survived the operation. Her body was rewarmed. Her circulation was restored, and in time, she woke. For her family, survival itself was extraordinary. The surgery had carried immense risk, yet it had preserved her life. But Pam's account did not end with recovery. She spoke of the operating room perceptions, the sounds, the instruments, the voices, and the journey she believed had taken her beyond the physical world. Her testimony was later shared in interviews and studied by people interested in near-death experiences. For supporters, her case raised a profound possibility. Perhaps conscious experience is not entirely produced by the brain. For critics, the answer lies in the complexities of anesthesia, sensory perception, surgical timing, memory formation, and the ways people reconstruct experiences afterward. Both perspectives agree on one fact: Pam Reynolds endured a medical ordeal few people could imagine. What they disagree about is what, if anything, her experience reveals about consciousness itself. To understand why Pam Reynolds' story remains so controversial, it helps to separate the surgical timeline from the experience she later described. There was anesthesia, the preparation of the surgical equipment, the cooling of her body, the monitoring of auditory responses, and the period of circulatory arrest. Then came the repair, rewarming, and recovery. The question is not simply whether Pam had an extraordinary experience. She clearly believed that she did. The question is when her reported perceptions were formed. Supporters of Pam's account focus on the apparent accuracy of her descriptions. They argue that she reported unusual details under conditions in which ordinary sight and hearing should have been severely limited, and ask how an anesthetized patient, with eyes taped shut and monitoring equipment in place, could later describe aspects of the operating room. Critics point to the timeline. They argue her reported perceptions could have occurred before full circulatory arrest while surgery was being prepared or conducted. They note that auditory monitoring clicks do not necessarily mean all sound was blocked under every condition, and that memory can be formed, fragmented, and reconstructed during transitions into or out of anesthesia. This is the part of the story that cannot be solved with a single dramatic sentence. The medical record can document vital signs, procedures, and timing, but it cannot perfectly timestamp an inner experience. And that is why the case continues to hold people's attention decades later. It sits directly at the meeting point of two very different kinds of truth: what medical instruments can measure, and what a person says she experienced at the edge of death. The Pam Reynolds case became famous because it appears to exist at the border between measurable medicine and deeply personal experience. The documented portion is substantial. Pam had a life-threatening aneurysm. She underwent a rare surgical procedure involving deep hypothermia and temporary circulatory arrest. She was anesthetized. Her ears were fitted with equipment for auditory monitoring, and after the surgery, she reported perceptions from the operating room and a journey beyond it. But the conclusions drawn from those facts are sharply different. Pam's supporters argue that the reported observations were accurate enough and the conditions unusual enough to challenge conventional ideas about consciousness. They see her description of instruments and surgical conversation as evidence that awareness may continue when ordinary perception appears impossible. Critics argue that the memories may have been formed before full circulatory arrest or while Pam was recovering from it. They question how precisely the timing can be established and note that a vivid experience, however meaningful, does not by itself prove where consciousness comes from or what happens after death. There is one point on which both sides can agree. Pam Reynolds survived one of the most extraordinary operations in modern medicine, and she emerged with a story that she never forgot. Pam Reynolds lived for years after the surgery. Her story traveled far beyond the hospital room where it began. For some, it became a source of hope, a reminder that love may be larger than the physical body, and that death may be a transition rather than an ending. For others, it became a reason to study consciousness with greater precision, greater humility, and more careful methods. Pam's story cannot tell every person what to believe, but it asks a question that medicine can measure only partially. What happens inside the mind when the body reaches the threshold between life and death? Perhaps the answer lies in biology. Perhaps it lies beyond biology. Perhaps the truth remains somewhere in the unanswered space between science and spirit. Pam believed she had seen something beyond fear, something beyond the operating room, and something beyond death. Pam Reynolds entered surgery because a damaged blood vessel threatened to end her life. She survived, but she said part of her had gone somewhere else, somewhere filled with light, familiar faces, and a love she never forgot. Her case remains controversial. Her experience remains deeply personal, and the question it leaves behind has never stopped echoing. When the body falls silent, does consciousness fall silent too?